So today we will continue the nerves of the sacral plexus that supplies the lower limb. We have already discussed about the sciatic nerve, right? Today we'll continue the continuation of the sciatic nerve, the course of the sciatic nerve in the lower limb. That means the branches of the sciatic nerve in the lower limb, right? Let's admit Jagati. Okay. So the tibial nerve, okay. Tibial nerve. The tibial nerve is the larger component of the sciatic nerve. So there are two components, tibial and common peroneal components, right? So this is the larger component of the sciatic nerve, is derived from the ventral branches of the anterior divisions of the fourth, fifth lumbar and first to third sacral ventral rami. That means L4, L5, S1 to S3. All these dorsal rami. Right? Sorry, ventral rami of anterior division. So that is the tibial part. It descends along the back of the thigh and popliteal fossa to the distal border of the popliteus, right? It then passes anterior to the arch of the soleus with the popliteal artery and continues into the leg, right? So if we see, so what is this tibial now? So you see, so this is the tibial now, the selected structure, right? In the continuous in the and that is the place where at the junction of the lower 1/3 and the upper 2/3 of the thigh, it divides into tibial and common peroneal components, sciatic nerve, right? So the tibial component is this, the selected structure. This is the tibial nerve, right? Like that. And if we add muscles, okay, we are adding muscles. So this is gastrocnemius, and if we hide it, this is the soleus, right? So it is going in the arch of the soleus, right? It then passes anterior to the arch of the soleus with popliteal artery and continues into the leg, right? So that is it. That is the arch of soleus, right? Okay. In the thigh, it is overlapped proximally by the hamstring muscles and it becomes more superficial in the popliteal fossa. So if you see all muscles, so it is more superficial only in the popliteal fossa, right? So it is superficial in the popliteal fossa, whereas in the thigh it is covered by the hamstring muscles. At the level of the knee, the tibial nerve becomes superficial to the popliteal vessels and crosses to the medial side of the artery. In the distal popliteal fossa, it is overlapped by the junction of the two heads of the gastrocnemius. You see, these are the heads of the gastrocnemius. This is the head, gastrocnemius muscle, selected structure. Yes, this is the tibial nerve, right? So, overlapped by junction of the two heads of gastrocnemius muscle. In the leg, the tibial nerve descends with the posterior tibial vessels to lie between the heel and the medial malleolus. You see, so if we remove the structure, see, this is the medial malleolus, right, going into the tarsal space, right? So that is how, and it has branches, right? So those are the branches, the medial and lateral plantar nerves. So if you add this, so this is how it is going between medial malleolus and heel. Proximally, it is deep to the soleus and gastrocnemius. but in its distal third it is covered only by skin and fascia and overlapped sometimes by flexor hallucis longus muscle. So in the proximal part it is covered by gastrocnemius and soleus, right, in the proximal part, but in the distal part it, okay. Sorry. So you see in the distal part it is covered by skin only. You see that is the distal part. Okay. So right. At first middle to the posterior tibial vessels, it crosses behind them and descends lateral to them until it bifurcates. It lies on the tibialis posterior from most of its course except distally where it adjoins the posterior surface of the tibia. So if you remember the legs of the, so these are the, so let's hide it and again let's hide it, again let's hide it. So this is the tibial now, okay. This is the tibialis posterior. So in the most of its course it lies on the tibialis posterior, but in the distal part it adjoins the posterior surface of the tibia. You see, this is the tibia, adjoins the posterior surface of the tibia, right? So sorry, the tibial nerve ends under the flexor retinaculum by dividing into medial and lateral plantar nerves. Okay, I have already shown you. So this is the flexor retinaculum, right? So this is flexor retinaculum. If you remove all muscles, okay. So this is the lateral. Sorry, this is the medial, and this is the lateral plantar nerves. Okay, it divides like that. So those are its branches. So this is the tibial nerve, the diagrammatical representation, right? Tarsal tunnel, right? You see how the gastrocnemius muscle, soleus are all. So the branches are articular branches, muscular branches, sural nerve, medial calcaneal nerve, and medial and lateral plantar nerves. Articular branches that supply joint. Articular branches to the knee joint accompany the superior and inferior medial genicular arteries and the medial genicular arteries. So this is the genicular anastomosis around the knee joint, right? If you remember the diagram. So these branches accompanies that. They form a plexus with a branch from the obturator nerve and also supply the oblique popliteal ligament. The branches accompanying the superior and inferior medial genicular artery supply medial part of the capsule. A branch of the nerve to popliteus tibial nerve, right, supplies the posterior portion of the superior tibiofibular joint. Just before the tibial nerve bifurcates, it gives out the branches that supply the ankle joint. So both to the knee and ankle joint it supplies, both to the superior tibiofibular joint and the anterior part of articular surface, right? Coming to the muscular branches, proximal muscular branch arise between the heads of the gastrocnemius and supply gastrocnemius, plantaris, soleus, popliteus. Then now the soleus enter its superficial aspect. So you see, if you remember the muscles correctly, right? right? So this is the gastrocnemius, it supplies that, and this is the soleus, it supplies that, right? This is popliteus, and this thin muscle is plantaris. So it supplies all these muscles, right? Gastrocnemius, plantaris, soleus, and popliteus. The branch to popliteus descends obliquely across the popliteal vessels, curling round the distal border of the muscle to its anterior surface, right? So this is the popliteus muscle. See, right? It also supplies tibialis posterior, superior tibiofibular joint, and tibia. So tibialis posterior you have already seen. So this is the tibialis posterior. Most of its course it lies on. This one is the tibialis posterior, right? It also supplies this tibia and knee joint, and gives off an intraosseous branch that descends near the fibula to reach the distal tibiofibular syndesmosis, right? Muscular branches in the leg either independently or by a common trunk supply soleus posterior, flexor digitorum longus, flexor hallucis longus. The branch to the flexor hallucis longus may accompany fibular vessels. So this is flexor digitorum longus, and this one is flexor hallucis longus, right? So these are the tendons that goes through the uh, tarsal tunnel, right? Tibialis posterior, flexor digitorum longus, and flexor hallucis longus. So you see different muscles and how it's applying all those muscles, right? Sorry. See, this is the tibial now, and all the different muscular branches they are, different muscles, and how it is applying it, right? Gastrocnemius, soleus, deep flexor, that means tibialis posterior, and all those things. Coming to the one of its branches, another branch, sural nerve. The sural nerve descends between the heads of the gastrocnemius, reaches the deep fascia proximally in the leg, and is joined at the variable level by the sural communicating branch of the common fibular nerve. Some authors term this branch the lateral sural cutaneous nerve and call the main trunk from the tibial nerve as the medial sural cutaneous nerve. But you will call this as only sural nerve, right? It's a cutaneous branch. The sural nerve descends lateral to the calcaneal tendon near the short sharpness line to the region between the lateral malleolus and the calcaneus. Remember that, and supplies the posterior and lateral skin of the distal third of the leg. It then passes distal to the lateral malleolus along the lateral side of the foot and the fifth toe, supplying the overlying the skin. It connects with the posterior femoral cutaneous nerve in the leg with the superficial fibular nerve on the dorsum of the foot. Sural nerve is often used as an autologous peripheral nerve graft on the grounds that it is easily harvested, readily identified, and exclusively cutaneous. So it is used as a graft. So this is the sural nerve. It is penetrating the deep fascia, so supplying the skin of the posterior and lateral third of the lower third of the leg and lateral side of the foot, right? So this is the sural nerve. Okay, selected structure. If you see, this is the tibial nerve. Lateral side, it is the sural nerve, right? If we add muscles, so this is the cutaneous branch. You will know that how it is lie. It lies outside of the muscles and lateral to the calcaneal tendon. This is the tendo-Achilles or tendocalcaneus. So it is supplying all of that area and foot and the fifth toe. right? That is the sural nerve. Okay, okay. So lesions. Tibial nerve is vulnerable to direct injury in the popliteal fossa, where it lies superficial to the popliteal vessels at the level of the knee, or to the compression at the tendinous arch of the soleus. So it can be compressed over there in the popliteal fossa and at the soleus arch. It may be damaged in the compartment syndrome that affects the deep flexor compartment of the calf. The tibial nerve or the medial and lateral plantar nerves may become entrapped beneath the flexor retinaculum or the so-called plantar tunnels, right, beneath the fascia of the abductor hallucis at the ankle, resulting in the tarsal tunnel syndrome. We have already discussed this in the previous classes. This is the tarsal tunnel, right? So different structures: flexor hallucis longus, tibial artery, another tendon, another tendon. So along with those things lies our tibial nerve. So here it is. So it can be, so right. So this is clear. This is the flexor retinaculum which created the tarsal tunnel, right? Coming to the another branch, medial calcaneal nerve. Medial calcaneal nerve rises from the tibial nerve and perforates the flexor retinaculum to supply the skin of the heel and medial side of the sole. See, this is the medial calcaneal branches. So these, okay. Right. Coming to the another branch, medial plantar nerve. The medial plantar nerve is the large terminal division of the tibial nerve and lies lateral to the medial plantar artery. From its origin under the flexor retinaculum, right, it passes deep to the abductor hallucis and appears between it and flexor digitorum brevis, right. We'll stop right there. So this is the medial plantar, right. So you see, this is the medial plantar, okay, originating. This is the place of origin, right, from the tibial nerve. This is the medial plantar and this is the lateral plantar. So we are discussing about the medial plantar. Okay, these are the muscles. Okay, so this is abductor hallucis, right? Right. So what we have read, it passes deep to the abductor hallucis and then appears between abductor hallucis and flexor digitorum brevis. Gives a medial proper digital nerve to the great toe, right? So this is the abductor hallucis, right? We'll hide it. So this is flexor digitorum brevis. So this is this medial plantar nerve lies between these muscles, right? This is medial plantar nerve. So this is abductor hallucis. Will this is flexor digitorum brevis. So it supplies those two muscles and gives a great digital artery to the fifth great toe. So this is the structure. Proper digital nerve to the great toe and divides near the metatarsal basis into three common plantar digital nerves, right? 3 common. So this one, this is the 3. It is not well represented in this atlas, but it divides into 3, right? So one is a proper digital branch to the grade toe, and there comes three common plantar digital nerves. Cutaneous branches pierces the plantar aponeurosis between the abductor hallucis and flexor digitorum brevis to supply the skin of the sole of the foot. Muscular branches supply the abductor hallucis, flexor digitorum brevis, and flexor hallucis brevis, and the first lumbrical. Right? Remember that. First lumbrical. The first two arise near the origin of the nerve and enter the deep surface of the muscles. So, abductor hallucis, flexor digitorum brevis, and flexor hallucis brevis. So this is the flexor hallucis brevis. So it supplies that muscle also. Okay, that is the flexor hallucis brevis, right? The first, the branch to the flexor hallucis brevis is from hallucal medial digital nerve, and that to the first lumbrical from the first common plantar digital nerve. Articular branches supply the joints of the tarsus and metatarsus. So it gives one great branch to the great toe, okay, proper digital nerve, and again it divides into 3, right? And it has cutaneous branches, muscular branches, and articular branches. Articular branches supply tarso-metatarsal joints. Muscular branches supply the muscles over there, and cutaneous branches supply the skin over the sole. And the 3 plantar digital nerves pass between the slips of the plantar aponeurosis, each dividing into 2 proper digital nerves. Okay, each 3 again divides into 2 proper digital nerves, right? The first supplies the adjacent sides of the great toe and second toes. So we'll do one thing. So 1, 2, 3, 4, 5. 2, 3, 4, 5. So first one supplies the adjacency of the sides of the great toe and second toe. So first one supplies this side and this second toe. Okay, it is not represented. Second supplies the adjacent sides of the second and third. Third supplies the adjacency of the third and fourth toes. Okay, so you see this is the proper digital nerve, right? Again you see these are the common plantar nerves. Okay, 3 branches, right? These are the 3 branches. Okay, common plantar nerves. Okay, now so again these divides into 2 proper digital nerves, right? So first common plantar nerve divides and supplies the adjacent sides of the first great toe and second toe, because this side, okay, medial side of the great toe is supplied by the direct digital proper digital nerve of the medial plantar nerve. So this side and this side is supplied by this branch, this side of the second toe and this side of the third, okay, by the second branch. 2 branches of the second common plantar nerve and third and fourth digits supplied by this one, right? It is more clear. So the first one supplies the adjacent side of the great toe and second toes. Second supplies the adjacent sides of the second and third toes. Third supplies the adjacent sides of the third and fourth toes, and also connects with the lateral plantar nerve, right? The first gives a branch to the first lumbrical, right? Each proper digital nerve has cutaneous and articular branches. So again, these digital branches have cutaneous and articular branches. Near the distal phalanges, a dorsal branch supplies the structure around the nail. Okay, again a dorsal branch, abductor hallucis, flexor hallucis brevis, and the first lumbricals all are supplied by medial branch. So remember those things: abductor hallucis, flexor hallucis brevis, and first lumbrical. Right, this one, first lumbrical. So I will show you something. So you see these are the lumbrical muscles, right? I will do one thing. Okay. So the selected structures which are like that. Okay. So these are the lumbrical muscles, whereas I will show you something. Okay. So these are the interosseous muscles, right? Interossei. They are called dorsal interossei, and so these are dorsal interossei, right? And those are plantar interossei. I will show you how they are located. Sorry. You see, this is the structure. These are the dorsal interossei and these are the plantar interossei, right? So these are the interossei, dorsal interossei. These are the plantar interossei. Okay, you will appreciate. So we will see that dorsal interossei, plantar interossei, whereas these are the lumbricals. Okay, so those are the lumbrical muscles. So those are the lumbricals, right? Lumbricals are embedded in the sole, whereas the interossei are more in the dorsal aspect, right? Plantar and dorsal, right? You see. So those are the dorsal interossei, and those are the plantar interossei, right? So medial plantar now supplies abductor hallucis, digitorum brevis, hallucis brevis, and first lumbrical muscles, right? You have to remember that. Okay, observe all these where it is dividing. So this is the medial plantar now. This is the innervation. Coming to the lateral plantar now. Lateral plantar now supplies the skin of the fifth toe and the lateral half of the fourth toe, right? And most of the deep muscles of the foot. It is located medial to the lateral plantar artery and course anterior toward the tubercle of the fifth metatarsal. It passes between flexor digitorum brevis and flexor accessorius, between these muscles, flexor digitorum brevis and flexor accessorius, right? We'll see how it is coursing. So this is this side, right? This is flexor digitorum brevis and this one is flexor accessorius, quadratus plantar. So this is lie between these muscles. If we remove this muscle, okay, so this is the lateral plantar now. Okay, so if you remove this muscle, it will be visible to us. And okay, and ends between flexor digiti minimi brevis and abductor digiti minimi by dividing into superficial and deep branches. So flexor digiti minimi brevis and abductor digiti minimi. Okay, so this is the abductor digiti minimi and this one is the flexor digiti minimi brevis. Okay, flexor digiti minimi brevis, this one is opponens digiti minimi. So this is flexor digiti minimi brevis and this is abductor digiti minimi. Okay, between these muscles it ends like that. Okay, lateral plantar now. Okay, remember those muscles. And before division it supplies flexor accessorius, abductor digiti minimi and gives rise to small branches that pierce the plantar aponeurosis to supply the skin and lateral part of the sole. Superficial branches splits into two common plantar digital nerves. Okay, only two. You see, two common plantar nerves, right? The stem is 2. Lateral side. So the lateral side supplies the fifth toe, flexor digiti minimi brevis, and the 2 interossei in the fourth metatarsal space, right? So in the fourth metatarsal space, those are the interossei, dorsal interossei and plantar interossei. In the fourth metatarsal space, right? It supplies those interossei. The medial one connects with the third common plantar digital branch of the medial plant. So medial nerve communicates with the medial plantar nerve and divides into 2 to supply the adjoining sides of the fourth and fifth toe. Okay, that means like this. The deep branch accompanies the lateral plantar artery deep to the flexor tendons and abductor hallucis and supplies the second to fourth lumbricals. So the first lumbrical is supplied by the medial plantar nerve, whereas the second to fourth lumbricals are supplied by the lateral plantar nerve, and it also supplies adductor hallucis and all the interossei. Okay, all the interossei, that means dorsal and plantar interossei except those of the fourth in the fourth intermetatarsal space. So that is supplied by the superficial lateral branch of the lateral plantar nerve, right? Branches to the second and third lumbricals pass distally deep to the transverse head of the adductor hallucis and travel around its distal border to reach them. So these are the, you see, accessorious digiti minimi, right? Superficial branch, deep branch, right? Deep branch supplying all the lumbricals and interossei, whereas superficial branch supplying digiti minimi brevis and those in the fourth metatarsal space. Okay, interossei of the fourth metatarsal space, whereas the deep branch supplies all the interossei, right? You see, this is the superficial branch, whereas this is the deep branch. So remember these muscles. Okay, abductor hallucis, flexor digitorum brevis, flexor hallucis brevis, and first lumbrical. 1. Flexor digitorum accessorius, digiti minimi, abductor hallucis, digiti minimi brevis, all interossei, and 2 to 4 lumbricals. So these are the branches of the tibial nerve, direct branches, tibial nerve. Okay, plantar is proplicius, tibialis posterior, digital longus, hallucis longus. Medial plantar, abductor hallucis, digital brevis, lateral plantar, right? Coming to the clinical anatomy, flexor retinaculum may compress the tibial nerve, right? Either its branches. Entrapment at this level is most commonly due to a space occupying lesion. Example, it may be a ganglion or compression by either a leash or vessels or deep fascia associated with abductor hallucis. Sometimes the compression of the first branch of the lateral plantar nerve, okay, it is called as Baxter nerve, by the deep fascia that covers the abductor hallucis has been implicated as a possible cause of chronic heel pain and of plantar fasciitis, right? The medial plantar nerve can be compressed at the knot of Henry. Remember the knot of Henry, which is the point where the tendon of flexor hallucis longus crosses deep to the tendon of flexor digitorum longus to reach its medial side in the sole of the foot. Right, soral nerve entrapment is usually not due to compression of fascia. Entrapment of the third common digital nerve as it passes deep to the internal ligament of the third. Okay, it is called as Morton's neuroma. You see, this is the knot of Henry. Morton's neuroma is an enlarged common plantar nerve, usually in the third interspace between the third and fourth toes. Right? So, this is the normal nerve. This is the neuroma, Morton's neuroma. This is how the Morton neuroma. Right? Any doubts? Any doubts?